Hi everybody, my name is Tiffany Janes. I'm an RN BSN student at the University of Central Missouri, and today I want to talk to you guys a little bit about artificial intelligence and cancer detection. I first want to start off by talking a little bit about the current technology that we have out there right now. There is AI Cure, which is a company that does management of chart reviews for patients. AI Doc does imaging analysis for time-sensitive things in radiology and pathology. Aidence does lung cancer detection and reporting and imaging analysis. There's CureMetrics. They also do imaging analysis, but they specialize in mammography. There's Ezra, which is a full-body MRI scan that can detect up to 13 cancers, and it is very expensive. It's about $2,300 per scan. And lastly, we have iCAD, which is also imaging analysis, cancer detection, but they also recommend specific therapy options for patients. Why is AI important to healthcare, especially cancer detection? Well, we can have faster and more accurate diagnosis, which ultimately means better patient outcomes for those that we can detect earlier. There's a study from Orvos and Einerson done in 2019, and cervical cancer was better detected using AI than humans. AI had a 91% accuracy versus humans 69%. There's also a skin cancer AI technology and algorithm that was developed by Stanford University, and Dr. Andre Estiva says that this technology performs at the same level as board-certified dermatologists. And lastly, there was also a study done by Lapa et al. In 2019, and they say that CNNs and AI have also improved the analysis of prostate cancer and how they image it. So I just talked a little bit about a CNN, and that is a convolutional neural network. And as a nurse, this is probably not something that I'm going to be able to explain to you very well, and something that a computer engineer or a coder or somebody like that could do a way better job of. But it's basically how computers recognize images. They use feature maps, filtering, pooling. They break things down into kernels and stack them on top of each other. Into this long line you see here, and until they get fully connected, they go through a network and something gets outputted, and that is how they recognize those images. So what would change if we implemented this in not just a couple hospital systems, but everywhere, or a large hospital system? This would create the need for a very large database to hold all of this information. Changes of workflow in healthcare would have to be done. Not just nurses, not just doctors, but everybody would have to understand the need for these. I'm sure that obtaining that information and sending it places, this would all have to change. We would all have to be trained on how to use these things and how to integrate that into our workflow. And just like anything, Kyung says that there is a chance for inaccurate readings and a small percent of error, and validation of these results is going to be needed at first. And I'm sure that there's a lot of doctors and healthcare workers that aren't going to trust this system as it first comes out. So, like I said, some of the potential challenges that this faces is the validation because of the small percent of error. Implementing these in not just a couple places, but large places, many places, so it can be useful and reach the most amount of patients. And like I touched on earlier with the Ezra scan being $2,300, this is for one scan. Imagine how much implementing a large system would be in a hospital system. It would be a very large amount of money. And lastly, I wanted to talk about the future of AI in healthcare. So, like I said, it's going to be faster, more accurate, which if we can detect cancer a couple years earlier, or if we can find things that may work for cancers at an earlier stage, this leads to much better patient outcomes and, satisfaction. Imagine if we could add 5 or 10 years onto a patient's life, even one person. Also done by a study, Lapa et al. In 2019, other AI methods are being developed, not just the convolutional neural networks, but there's also things like semantic learning machines. These are becoming better than before, and they're showing better results with each piece of research that gets done. Semantic learning machines are newer technology. They use the images that they take, they read them, do what they need to do, and then they gain more insight on those by looking at them and compiling the information to see if there's any other biomarkers that they can use for further image analysis and maybe pick up on things to detect this better than we knew before. So, and lastly, the other areas that can use CNNs and AI for image recognition as well. Imagine if we could do this for patients where we just intubated and we need to see if ET placement is correct, or if we could tell chest x-rays. I mean, the opportunity for this is limitless. It's not just cancer detection, but using this for image analysis, radiology, could make workflow so much quicker. I mean, imagine how many times we've had to wait for something to be read by a radiologist, or how ER wait times would go down, or CT reads for strokes. I mean, this could be huge. But because of the challenges of the future of AI and healthcare faces, this may be a long road of implementation and acceptance by the healthcare community, but it could be very well worth it because of all of the long line of benefits. Thank you guys for listening.